My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware, diet, and environments. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thanks for coming back for this episode of the Heavily Meddled Podcast. Today we have a guest from up in the Great White North. It's actually not very, well, it is kind of white right now, but we have Dr. Corrie Donner, who is a chiropractor, had a license for more than 30 years, who was disabled by her metal allergy and is going to talk to us about acute breast implant illness. If you didn't know, you know now that there are metals in breast implants, and I don't know a lot about this, so I'm really, really excited to have you here, Corrie, and she has nickel allergies, multiple metal allergies, so we're going to hear all about that. Thank you for coming on to talk to our wonderful guests.
Well, thank you for having me, Sherry. I'm happy to be here. Yeah, and share my experience. Hopefully it helps others, right?
Right. I don't remember how you found me, but some of my podcast guests don't know. I went viral on Facebook last week and had exposure to over 1 million people. It's just like,
and that's awesome.
It was awesome. So I have a whole influx of all these new people. I went from 200 subscribers on my little Facebook page and podcast to over 7,000 right now.
Oh, good.
So hallelujah to the algorithm for getting me out, because ultimately the goal is to spread this message, and it brought me people like you. So I'm super excited about this.
Yeah, and so am I. I happen to do podcasts in the morning, and I'm continually learning, even though I currently am unable to practice. And so I was scrolling one morning and I saw your little reel on Facebook, and I went, oh my gosh, I got to talk to my husband about this. I was so excited. I'm like, somebody's doing a podcast about this. Somebody's got information out there about this. I'm like, yes. So I was very, very excited, and I looked into it further. And then I happened to spread the word on a couple of breast implant illness pages on Facebook saying, hey, you've got to check out Heavily Meddled, because there's metal in the implants and within the silicone manufacturing. So I hope that brought you your viewers. I hope I helped.
I don't know who brought what, but right. I'll take all the places. But you know, the hard thing is, especially on Facebook, people don't realize the value of liking, commenting, and sharing. In a lot of these special focus groups, there's implant allergy groups, there's surgical clip groups, there's breast implant groups. But like some of these groups, and I tried to even just get into some of the general allergy groups, but most of these groups will not allow self-promotion. So even though this applies to so many people, I can't come in and say, hey, check out my podcast. Right now, it's hard to get into these groups unless other people share. So if you're there, share it like Corrie did. Share and spread the podcast, because that's how we find our tribe and get the word out to the village, because it's going to take a village. I am one person, y'all.
Right.
So,
and then you feel like you're not alone in this, because for so long I got the eye rolling and the, yeah, whatever. And I've never heard of that. And oh, sure, you think you do. And
well, I'm going to take 2 minutes and just show really quick. I got an email today and it just really touched me. This is a gal who is suffering from an allergy to permanent sutures, but it was the last paragraph that really went to me. She just said, my future daughter-in-law saw your post on Instagram and sent it straight to me. I cried because I didn't feel alone anymore. I'm getting those kind of emails, and you know how terribly alone we feel in this. My journey is similar to yours in a lot of ways, and we just get gaslit so much that, we feel terribly alone. And
so when I saw it, I went, yes. there's somebody out there that's
And when you
promoting
contacted me, I went, yes, because not everybody wants to come on video to tell their story in front of the whole world. I think it takes a special breed.
Right. Well, like I said, if we can just reach out and help as many people, and we won't feel alone. And then maybe we feel a little bit more empowered to advocate as this gets out there. Right. I found advocating very difficult, actually. Mm-hmm.
You would think, and we'll talk more about this as we get into the meat of your story, but you would think, being a credentialed medical professional, that you would have more respect from your peers. And I understand from a surgeon who is a guest on the podcast from time to time, and other surgeons I've talked to that believe in this weirdness that we're experiencing, that even if you're a peer, that is not the case.
No. And even in the breast implant illness world, there's nurses and nurse practitioners that have had trouble advocating for the symptoms that they're having and the complications from the implant process. But I think being considered fringe as a chiropractor, even when you talk the lingo and you have this common language, and somebody is saying, well, what about? You would think, I know when a patient comes to see me and they're a nurse or something, and they say, I think it's this. I'm like, hey, great. Let's look at that.
Our bodies have internal wisdom. It just blows my mind. And for anybody that doesn't know, and you can straighten me out on this as to timelines, but chiropractors basically go through half of med school, right? It's the same curriculum, isn't it? More or less.
It's the identical curriculum. We get way more nutrition. They, of course, focus on surgical procedures and prescriptions and that kind of biochemistry. But our education is identical. In fact, we also learn how to take x-rays, read x-rays, MRIs, orthopedics, neurology. So when a patient comes to see us, if they have a kidney stone, if they have a gallbladder attack, or if it's just a simple lower back strain, we have to be able to tell that person what we think, right? And form a diagnosis. We're legally by law able to diagnose too. So there comes the big responsibility with that, right?
Right. It blows my mind that credentialed professionals in the medical genre and
realm
spectrum do not get respect from their peers. And
right.
That is a goal of the podcast, to change that narrative.
Yes, exactly.
Let's get into your story.
My earliest recollection of having probably likely issues with surgical steel was when I had a tonsillectomy in 1972. And so back in the day, they removed your tonsils, and my sister and I, we were a 2-4. They decided we're passing it back and forth. We're both very sick all the time. Let's just do both sisters together, remove their tonsils. And my sister healed very, very well. And I didn't. I was extremely swollen. I had a complicated recovery. And to this day, when people look in my throat, they go, oh, what's that? And I have basically what I would call layman's terms blood blisters or hematomas in the location of my tonsils, because I had such an inflammatory reaction back there. And so we thought...
Let me interject real quick. So when they remove the tonsils, what are the metal components that would have caused that reaction in a tonsillectomy?
It would have been contact with a certain tool that's made out of surgical steel. And percentage of alloy, who knows, but obviously I had a reaction. And then we decided to get our ears pierced. So my sister and I go together and get our ears pierced, and we were quite young. I was about 10 years old or so. And again, my sister, no problems. And they used to put these big metal, I call them Frankenstein posts in. They weren't earrings at the time. There were these ugly gray metal posts that they put in initially. And then once you healed up and those came out with a special gun, they went in, and with a special gun, they took them out. Horrible. My ears were swollen and red and oozing and itchy. And everyone kept saying, well, use hydrogen peroxide, use polysporin. And then my mom said, well, gee, you must be allergic to these metal posts if that's possible. So around that time, we decided to take them out, and my grandfather bought me some gold cross earrings for my birthday, and I put them in, and no problems. So we determined that, okay, it must have been those posts. But over the years, you see these cute earrings, and they say hypoallergenic. So I'm like, oh, cute. Absolute disaster. The second I took out the gold earrings and put in something a little bit more 80s trendy, my ear would blow up and I'd be back to square one. I'd have to take them out and just put the gold ones back in, which was fine. Everybody said, well, it's obviously a sensitivity. So about grade 7, I joined the concert band. And so I'm a pianist, but I decided to play the flute. There's no piano in the concert band. The flute would contact right below here as it rests. And I developed horrible blistering. At first, it was an itchy kind of a rash, very unattractive. You're very self-conscious when you're 13 years old, yeah, and you're walking around with these horrible sores. And they would crust over, and every time I'd play the flute, but we didn't put 2 and 2 together because the doctor at the time, my family doctor, said, well, it's Impetigo. So the flute was probably not cleaned properly. It's a bacterial. And I'm like, but why does it keep happening? We're cleaning the flute. We're using rubbing alcohol. We're, disinfecting this. And so he said, maybe it's the nickel. And so he said, get some clear nail polish and cover the opening that makes the contact. And sure enough, did that and problem solved. But that's as far as it really got. But in my history, even riding the bus and the metal railings on the seat, if you're standing and you're waiting to get off and you make contact with that, sometimes I would have a reaction where my hand would get very itchy and swollen. If I was wearing a ring, I couldn't get it off. And it would last for a few hours. So I thought, okay, obviously a contact kind of a reaction. And then I had my molars extracted when I was 13, and we thought I was actually swollen way out to here. And it took me about 3 to 4 weeks to heal from that, which again, nobody could explain, but they said, oh, it must have been a codeine allergy. So I went my whole life thinking I was allergic to codeine.
But it's just exposure to the equipment that took out that extracted your molars. Wow.
Yes.
We're not even talking metal fillings then, right? We're just talking the dental tools.
The dental tools, yeah. And so then, of course, I didn't have a lot of cavities, but I would say I had a total of 4 metal fillings. I got them replaced when I was 30. I think they were put in when I was 15 years old. But in that time, I'd had C-sections and just different things where I would have horrible response to healing, and it would always seem like an infection. If we think about metals and we don't think about the actual contact dermatitis or the reaction I had to the surgical tools, when I was in chiropractic college, I developed severe fatigue. I was exercising, I was doing aerobics. We had a full program. So I was exercising for stress relief and found myself unable to hold my blow dryer up, or if I have to get dressed, I'd have to sit on the bed and rest. And I was breathless going up and down the stairs. I was feeling horrible. So my thyroid was starting to
I was going to ask if you had thyroid trouble, because when you're allergic to metal, it attacks the thyroid right off the bat.
Right. So here I am going through chiropractic college, feeling like I have my piano tied to my butt. Since then, they've changed the lab parameters for the TSH readings and T4 and stuff. But yes, I would go up and down. And she's kind of like, well, it's not definitive. So I suffered for a couple of years that way. And then went to see a friend of mine I went to high school with. She became an MD, and she goes, Corrie, this is not you. And by then I had swollen lymph nodes. My hair was falling out. I was puffy. And I said to her, I could just roll over and fall asleep on your clinic floor here. I'm so exhausted. And she goes, no, there's something wrong. I know you, which was great because you have somebody who knows you through school and all
believes you.
Presenting very sick. But again, we know so much more now. In chiropractic college, we learned about dental amalgams and mercury, but it wasn't say, hey, it could be your fillings. And certainly, even when I mentioned it after I had them removed, that I felt so much better. They were testing me for autoimmunity. I was kind of borderline, yes, maybe not. Where do we place her? It's not lupus. It's not this. Maybe it's mixed connective tissue disease. Just take care of yourself. And it was about 6 months after I got my dental amalgams out. And I went, I don't have Raynaud's phenomenon anymore, where your fingers are turning color. Yeah. And sometimes I'd be in clinic and a patient would say, hey, did you have blueberries for lunch? And I'm like, no, my lips just go purple. So all of that went away. And I went, it's the metal fillings.
So you made that connection. What year was that? I'm just curious.
1996.
Oh, and you made the connection to the metal fillings in 96.
Yes,
but we had the fatigue.
Yeah, I was a mess. And I'm like, this is crazy. I just had my daughter. She was born in 95. I'm like, I got kids to raise. I got a practice to run. I don't have time for this. I just went, why am I suspiciously feeling so good? What has really changed? And the only thing that changed was I had my fillings removed. What's interesting about that is when everybody said, well, geez, like, how is this going for you? Or how are you feeling? I'm like, I'm fine. When they asked me and I said, well, I've got my old dental fillings out that were 15 years old. And now I feel so much better. I got the eye roll. And then, end of conversation. Kind of like, yeah, sure. Sure. So I went, okay, not a topic to discuss with my family doctor or any kind of specialist I would see, or a dentist even. That's what really made the big difference. Now, in terms of the breast implant illness, very, very different kind of a thing. But that reaction to mercury does resurface here in 2021 when I finally saw an allergist. C-sections were complicated and always went back into the hospital with infection. And my family's like, okay, Corrie's having a surgery. Okay, she's going to go back in because we don't know.
Do you know if they left any surgical clips during your C-section?
With the second C-section, they cut and stitched what's called your cecum of your large intestine, where the appendix is. They stitched it to my abdominal wall. So they actually punctured it. So I became septic. So in addition to the metal allergy, and I had blistering, which they thought might have been flesh-eating disease. All these blisters surfaced about day 4. But then I also had signs of a really serious infection. They didn't think I was going to survive. I had so much going on at the time. And then discovered I was allergic to morphine. I just went, okay, well, that's over and done with. I had issues for 14 months afterwards. And so they went back in and they won't exactly tell me. We just thought maybe they left sponges or something, or maybe it was metal clips. I'm not sure. But I had a laparoscopic surgery to fix that issue and remove scar tissue. And the anesthesiologist said, oh, Corrie, you're going to feel so much better. What a mess in there. The OBGYN comes in and goes, I don't know what you're complaining about. It's just a little patch of scar tissue. But whatever they did in there and whatever I'll never really quite figure out, I felt better. So maybe it was the scar tissue. Maybe it was clips. I'm not sure.
You became aware about this time that you had the MTHFR mutation, correct?
Yeah, it was after I had the problems with the C-section and I started to question my allergy to nickel and surgical steel. I went to several specialists and they all said, no, we don't know how to test for that. And, no, it doesn't really exist. And, no, it can't be. And I'm like, okay, well, I blister and it looks like a burn and it's getting worse with each procedure, but I really need to figure this out, right? Because I knew I was having knee surgery after a car accident. I stumbled upon a specialist because of all the issues I'd had going back in after my surgeries. She goes, oh, by the way, she was a blood specialist. She's like, you have elevated homocysteine. And I'm like, oh, my mom has elevated homocysteine. But I also know that cardiovascular disease and peripheral vascular disease runs in my family. So I thought, oh, that's not good. This was back in 1999. I think maybe the internet was in its infancy then, but certainly didn't have access easily to medical research articles and things like that. But she just said, hey, take B6, B12, and folate. So I did. But it wasn't until I had this reaction with the implants that I started to go, wait a second. Elevated homocysteine. I must have issues detoxifying. So I did a deep dive into the MTHFR gene defect for improper methylating, which is key to detox. And I went, crap, I think that might be my issue. But again, I couldn't bring it up to anybody. I think I figured out why some women react and some don't. It's a detox issue. It's an overload on the system. And I'm like bursting with this exciting information. And after I had my implants, I went to talk to a brilliant internal medicine specialist who used to be a chemical engineer with NASA. He used to treating Lyme and things like that. So he was kind of like, I've seen weird stuff. I believe you. But to talk about the gene defect and detoxification and methylation, it was just, he goes, I got a friend in functional medicine that kind of deals in that stuff. Like it's fringe, right? But it's biochemistry. It's not a mystery. It's an entity. It exists.
We know that people with metal allergies often have issues with the thyroid. I wonder how many as a percentage would have also MTHFR defects. It's more common, but I also wonder about the commonality in the metal allergic community. That would be interesting. I don't think there's been a study performed on that.
This internal medicine specialist, Dr. Hamilton, really cool, smart guy. He goes, send me your articles on breast implant illness and we'll write a case study together, something which has yet to be done. But my hope would be that I could be involved in some kind of research. Because when you dig into this and it talks about Hashimoto's thyroiditis, metal sensitivities, right? And then the gene defect and the poor methylation and detoxification. We're onto something there.
Right. Okay. So next we're talking about your cyst on your shoulder.
Yeah. Well, it just had a sebaceous cyst. Got time to get it removed. It was kind of unsightly. It's on the back of my shoulder. I didn't see it, so I didn't care. But everybody else went, no, it's getting bigger. So anyway, I went to see a plastic surgeon. And he cut it out. I go, we'll just remove it. But he did an aspiration to find out what it was in office. And he put a needle in and sucked it out and went, oh, it's just this. So I went, oh, great. But then over the next few days, it got hot and swollen and painful. So I called the office and I said, hey, I'm scheduled to get this removed. Could I have an infection in there? Like, I should let you know that this is going on. Oh, no, it'll be fine. It's no problem. Well, it took him an hour to cut it out. So with the surgical tools, right? Whatever he was using, scalpel, forceps, whatever, an hour of contact with these tools, it swelled up. I couldn't even use my shoulder. Blistering, really, really red hot, excruciatingly painful, and literally I'm sweating. I have sweat pouring down my face. So I go to see him and he's trying to take the steri strips off and I am screaming. I have a high pain threshold. The plastic surgeon, I'm like, I've never seen this before. Okay, I got a few more to take off, and just kind of left me that way. And eventually, over a course of a couple of weeks, it burnt itself off. I guess the immune system kind of went, yeah, we're done with this. But then I had a melanoma that I had developed on my arm, probably too many sunny beach days at Coeur d'Alene, honestly. So anyway, I went in to have this done, and the plastic surgeon said, I told him my situation with my surgery. He goes, we're not going to do that. We're going to cauterize it out. So, of course, they do a very deep and wide excision to make sure they get clean margins. No problem. I healed beautifully for the very first time. So I went, okay, we're onto something here. I know it has something to do with the surgical tools. He goes, let's honor that. Okay. And let's do it this way. And I went, wow, okay, great. I'm anxious to see what happens. And I had
Can you imagine
no problems.
Doctors started saying, let's honor that and do something different? Oh,
I'm all for it. And I'm like, okay, so then naively, I think, okay, well, I'm onto something. If this guy thinks that this is real, then every doctor I see after that will. And it wasn't that way at all. I had a knee surgery after a car accident, and same thing. He did honor my morphine allergy, which was great, but my knee swelled up and I had to take the wrap off. I didn't take the wrap off. I would have had nerve damage in my leg. I was starting to get foot drop. My knee was so swollen, Sherry, that if I moved it, it sounded like when you shift water in a hot water bottle. And I had absolutely severe pain. And of course, the ligament is so thick that the inflammation was trapped. The blistering was trying to surface, but it was so bad that the rehabilitation was next to impossible. And the physio's like, did they do a debridement where they would scrape cartilage off the back of the kneecap? Orthopedic specialists like, no, we just removed some meniscus. Well, something's not right here. And I literally had to tear through scar tissue. I had to tie a rope tie to my foot, lay on my stomach and rip and pull the scar tissue and force my knee into flexion to break through the scar tissue. And everybody's like, well, you should be fine in 5 days. Months later, I kept my MRI appointment because it's hard to get an MRI appointment in socialized medicine unless you pay. And this was way back then too, like in 2003. And so why did you go get a knee MRI? I fixed it. I'm going, well, I'm still having these issues. So it wasn't until a locum doctor for my family doctor looked at my knee 3 months later and said, why is it like this? Let's give you some prednisone. Boom, gone. So I'm like, there's got to be something to the surgical tools. And again, I was sent to an allergist prior to this because I was worried. I thought, geez, as a chiropractor, I need to stand, I need to work. But it was 18 months of rehab on that because of the swelling and the scarring after having that surgery. And I started to think, oh, geez, you know what? If I need something a little bit closer to the heart, or if I need a stent.
You got to figure this out.
Yeah, I got to figure it out. But they kept saying, no, we don't think this is real, or okay, maybe it is, but we don't know what's causing it. So then I got a tooth extraction done. Same thing. I was in agony and there's nowhere in the jawbone for the swelling to go. So the immune reaction was happening while I was still frozen. I could feel it in the bone. I thought, oh, here we go. And he said, no, you'll be fine. And he was drilling into the bone to get the roots out. I phoned the office. As soon as I got home, I'm reacting. Well, no, that's impossible. Here's some tramadol. And that didn't even touch the pain. And so I had
tramadol. Here's some Valium. Here's
some codeine. And here's some whatever, right? Like painkillers. And nothing was touching the pain. I think I slept 5 hours in 3 days. But I had a little electronic acupuncture unit I would use for patients, and I would put it in that location just to get relief. And that's all I did to try to keep on top of the pain. So I went back to see him, and he's like, oh, geez, just a little bit of red and swelling. What did they do when this happened to you last time? And I said, they gave me prednisone. So he goes, okay, I'll give you 3 days worth. And again, shuts the immune system down, immune reaction down.
On prednisone,
just enough to get me over the reaction and to get me healing again, right? To stop that aggressive reaction. So then I ended up with another referral to a dermatologist, and I told him what happened to me. And he goes, Matt, that could be a nickel allergy. Nickel allergies are really common. I said, can I get tested? He goes, well, I don't think there's anybody that does that. But here's a script. Fill it with prednisone tablets. Keep it in your purse in case you need a dental extraction or something. You take it before the day or two later and kind of wean and cut the pills in half. You don't want to be on this stuff for a long time. I'm like, oh, I understand. So I had it with me. Tell your family, okay, mom's allergic to morphine and it's surgical steel and she needs prednisone before surgeries. And so they had it all memorized. My husband did. So fast forward to biopsy. I was diagnosed with breast cancer in 2020, right in the middle of the beginning of the pandemic. I had the prednisone and I figured, well, I'll just take some, go for my biopsy. It was no big deal, no reaction. They were in there and they were taking samples and stuff and no reaction. So I went, okay, prednisone's doing its job. So then we fast forward actually a couple months later to when you could see the oncology surgeon. And I said, hey, what are my options? And he said, these are your options. I wanted something that was once and done. I didn't want to face a lumpectomy and then maybe another procedure and then maybe into a mastectomy. I wanted to get back to work and I wanted to just move on with my life. My mom had breast cancer and her mom had breast cancer. I thought, my mom had a single mastectomy and she always regretted not having the other one because it was hard to fit things properly and everything. So I'll have once and done. The risk of getting it in the other breast, there was some risk there within 10 to 15 years. He said, you could do implants. And of course, at the time, when you're working through a diagnosis and you're not sure if it spread to the lymph nodes and you're researching aromatase inhibitors, the estrogen suppressing medications, and you're looking at what radiation does to the left side in terms of the lung and the heart. And everybody's got their own decisions to be made. I thought, I don't know what it would be like to have such a drastic surgery. I really didn't have time to process that. I met with the plastic surgeon only a week before surgery. I had learned about breast implant illness. And again, being a chiropractor and bringing it up, they're like eye rolling. And they said, no, not these new ones. We've had issues with breast implants in the past. And there is a history of having problems with implants and them being on and off the market. And I thought, since my mom's surgery in the 80s, maybe they have improved them and there's no reaction. So I trusted them and I said, well, I still have Hashimoto's. I hear that's a contraindication. No, you'll be fine. No, all you have to worry about is infection and contracture, where the scar capsule really gets hardened around the implant and it's quite painful. And I said, any metals in there? Oh, no, silicone is very inert. I'm like, okay. I get that. So I thought, well, I'll just go have my mastectomy with immediate reconstruction and carry on doing the prednisone thing. In fact, I met with a very nice doctor who happened to look after my mom. And he happened to be in clinic for pre-surgical consults, explaining this to him. And he goes, I've never heard of that before. Talk to the anesthesiologist. Never heard of that before. Well, I blister and it gets worse and worse and worse. So he goes, I wouldn't even know how to test you. I wouldn't even know how to help you with that, Corrie. And I went, okay. He goes, just do what you've been told to do. Take the prednisone before, take it during, and then wean after. So I weaned myself down. I woke up after the surgery and I was under the help of the prednisone, right? I was under the effects of that. So it wasn't too bad. And then I weaned. And then, holy smokes, the pain, the swelling, the inflammation. I was just out of my mind in pain. And I would go into shakes and sweat. And the plastic surgeon goes, well, I've never seen this before. And she's trying to peel the steri strips off. And I am like coming unglued. I'm like, this is excruciating. She goes, okay, go back on the prednisone. We've weaned too soon. So now you fast forward weeks and weeks and weeks ahead of time, and not knowing what had happened during my surgery either. They had prepped me for placing the implants under the pecs, but because being a chiropractor, please don't touch the pecs. This is what I need to work. I'm very physical, very hands-on. I played the cello, I played the piano, I cut the grass. I'm a hands-on kind of person. I love to paint walls. I am very physically active. Yeah. And of course, my livelihood is very important, right? So with that, I had obviously been reacting to the implants and ended up in and out of urgent care and the emergency at the hospital there. Elevated heart rate, everything looked like infection. And then they're saying no. And even one of the doctors said, this looks like a cellulitis. I had a rash appear. And so I took a pen and I drew a circle around it so I could watch to see if it spread beyond the boundaries to see if this was the cellulitis. And it had, in fact. So I went in. He goes, good thing you came in. But having gone to infectious disease the next day, they're kind of like, you're wasting my time. Like, this is an infection. Like, suck it up. Your pain isn't proportionate to what you look like. And the nurses everywhere I went said, oh, you're reacting. You're rejecting the implants. We see this all the time. Infectious disease doctor walked in and nope, that can't be it. Nope. And everybody I talked to, nope, silicone's inert. So here I am, sleepless nights going, okay, what could cause pain and swelling with implants? What could cause post-mastectomy pain? What? And I'm just trying to figure this out. I had developed a Parkinson's tremor in my right hand. I have a video of it. I had weakness in my left lower leg. It would go numb. I had POTS. So that's an autonomic dysregulation. Where I would just be sitting still and my heart rate would be 115. I'd go and walk across and get a cup of coffee and my heart rate's 125. I walk the block and I'm at 150 going, okay, guys, I'm going for a walk in case I pass out. Never had blood pressure issues. I was having high blood pressure and then I developed breathlessness. I just think it was just so much on my system and I couldn't even climb a flight of stairs. So they thought I had a pulmonary embolism. So back to the hospital I'd go during a COVID thing. And nobody really clued in until the symptoms just became so incredible that I was on every pain medication. I refused to take opiates. I couldn't function. And I had 6 good days in 8 weeks. Oh. And they sent me to internal medicine. So I got to meet Dr. Hamilton and explain my situation. He goes, this is weird. I'm fit. I'm healthy. I work out. I'm no sick days. I don't see a doctor. Everything checks out. And all of a sudden you have this. And now look at where you're at. We better scan you. So he had me into the Foothills Hospital here within a week for an MRI. He goes, we better scan you for MS because when we look foolish if you lit up like a Christmas tree on the scan. Yeah. He ran every test, Lyme, Epstein-Barr, every autoimmune test. I had a huge blood panel done. Everything checked out negative.
Normal.
Yeah, and a lot of these women that are suffering, normal. Some of them do have autoimmune markers. I said to my sister, the only thing it could be, like maybe there's metals in there in the implants. So I went to the allergen manufacturer's site and I printed off their manufacturer's details. And there's a list of metals in the various parts of the implant and then petrochemicals as well.
Let me put a pause in that. So
yeah.
I know what silicone looks like, right? And I'm not allergic to silicone, thankfully. I know there are people that are.
Yes, there are. Yep.
So I look at silicone and I know metal allergies, right? So I'm super paranoid. I would go in and look at silicone. It looks like this white, inert, to clone a word that's become a terrible word for me. It looks like a clear, inert substance. It actually has metals within the silicone?
Yeah, as part of the processing and manufacturing, yes. So even a saline implant, which is filled with saline, the outer shell is silicone.
Because I was going to ask where the tissue exposure is. So the tissue exposure is not in the internal part of the breast implant. It's in the outer material that holds the internal fluid of the breast implant. Correct?
Yeah. And there are soft gel implants called gummy bears. So look at a gummy bear, cut it in half kind of thing, and they're semi-solid, right? Squishy. Okay. Those also have metal in them. I was blown away and I said, could this be my problem? I handed it to him over the counter on my way out. I thought, maybe someone will take this seriously. And he looked at it and I could hear him dictating after I left, heavy metals. And my report to my plastic surgeon, heavy metals. So I was scheduled for an explant 3 weeks later.
when you hear heavy metals, and I know I'm not going to be the only person that thinks this, heavy metals in the alternative medical community is usually stated in regards to toxicity. Heavy metal toxicity, heavy metal. We got to chelate out the heavy metals. You have this toxic amount of heavy metals in your body. Some people might do the urine cultures, the 24-hour urine collection. But people, we are not talking heavy metal toxicity. Allergy is completely different than toxicity. There may be people that are toxic and allergic, but we're primarily discussing allergy, not toxicity. So really important to make that distinction if there's medical professionals listening. And now, a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with MELISA testing. MELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. MELISA, a valuable diagnostic tool in medicine.
Yes, I believe it's both, because finding out that I have this gene defect for methylation and detoxification, maybe it was too much for my system. Maybe I had built up some heavy metals like we all do. Our environment has got them everywhere. And that was their thing. Well, there's heavy metals everywhere. So, what's the problem? There's one thing to have the contact dermatitis, and then there's one thing to have the metals leaching into your system. What they have found, Dr. Dijkman, I think, if I can pronounce his name properly, in the Netherlands, came out with a brilliant study in 2021 or 2022, showing that when you put the implant in a warm body, the temperature of the body causes the silicone to bleed into the surrounding tissues. It's got the metals in there. It's not just contained within the implant. And so as your body makes this capsule, which is a scar tissue, basically sac around the foreign body, it's porous. It doesn't contain the silicone and the metal containing silicone. They have found that in patients who have had these implants for a very long time, that they have silicone particles. They're very refractory with specific electron microscopy, and they found them in the lymph nodes. They found them in various locations. One lady who unfortunately passed away donated her body, and they had found silicone particles in the kidney, in the liver. It had migrated through her body. I believe there's two different things at play here, because I went through a detoxification reaction after the implants were removed. I did feel some relief, but I did a detox, and I did a hair analysis. And so I still have some heavy metals, but I detox daily anyway.
Let's talk about your symptoms.
Okay, sure. One of the odd symptoms I had this whole time was I'd be sitting there watching TV, and I'd be like, anybody smell that? I smelled like chemicals, and I had this weird odor to my body. And then when I would go to the washer, my urine smelled like chemicals. And I thought, holy cow, this is awful.
Now, could anybody smell it? Or were you experiencing something that I experienced, which was this kind of hyperreactivity in the immune system, where somebody that would smell something at this level all of a sudden becomes this level because the immune system is in overdrive? Do you think it was more that? Could anybody else smell it?
Nobody else could smell it. I was sticking my hand up Jay's nose, and I'm like, can you smell that? And my daughter, I'm like, smell this. Like, can you smell that? I thought I was losing my mind.
Lost it, right?
She's lost it. Yeah. But probably couldn't smell a piece of toast burning in the toaster. It was just everything, my essence, I had to live with the smell. It was always there. And then when I explanted, gone. So I could at least put up with myself.
So we were talking about the big symptom list. Talk about the symptom list here.
The pain and burning locally, of course. And then I developed high blood pressure within that week, vertigo within that week. I thought, everybody kept saying, what's benign positional vertigo? And I'm like, how do you go into surgery and wake up with vertigo? And with the otoliths disturbed, I'd be walking, and I'm walking like a drunk person too. I'm like, I've got ataxia. I would always drift to the left. And this was within the first 5 days that I was staying with my sister recovering, and she had a blood pressure cuff. And I'm usually like 106. I can be as low as 100 over, 60 sometimes, or 90. Yeah, really low blood pressure. And my heart rate is a healthy 60, 62 maybe. My heart rate was elevated. Like I said, it's just sitting. I could be 112, 115. And my blood pressure went up to about 145, 150 over 95. Like, geez, that's probably why I don't feel good. And I was nauseated.
I had the same issue. I went from being totally 100% fine to having PVCs, which are heart palpitations. You know what they are. I'm just explaining to our listeners, but I went from fine to having these heart palpitations. I was having something like 6 to 10 PVCs per minute. Let me tell you how uncomfortable that is. And they're just like, oh, you're stressed. Oh, you're anxious. And I literally had a time, it's only happened once, thank God, but it was the scariest moment of my life where my heart rate spiked to over 200 and my legs buckled. I almost collapsed. It was like an SVT, which is a supraventricular tachycardia, right in my living room. Again, people aren't believing you that this is happening. And I'm like, I was fine a week ago.
Yep. I was fine. Healthy.
I'm always
never
stressed.
missed
I've been
work.
stressed my whole life. It's never done this.
Right. Exactly. I had feelings of impending doom. I'd be standing there and then I'd have to go sit down. I've never fainted before, except I got close. And you kind of feel like things are tunnel visioning. I thought I was going to just drop and die. It's the worst feeling. It's kind of like PVC, like that roller coaster effect, but it just doesn't come back from there. It's like, I couldn't climb a flight of stairs. My legs were shaking.
And if you're like me, you actually lose friends because people ask how you are and you're like, well, this week, this is going on. And the list is like this long. And they're like, oh yeah, she's gone. Cuckoo for Cocoa Puffs, right? And then they don't even want to hear it anymore. So they stop asking how you are. And then they avoid you in the hallway.
Yeah. And I really didn't go anywhere because it was COVID, right? So I didn't really have any interaction with anybody, but my patients started going, when are you coming back to work? I thought you'd be back. And I'm like, well, I'm headed into my second surgery, which was the explant. I had to describe it to my doctor. Like, I'm physically fit. It just felt like I did 120 squats. Like my legs were so shaky and my arms were shaky and I had no strength. I had a lot going on with the surgical things that had happened and the things that happened with my shoulder during the surgery. I had migratory joint pain. I mean, I had excruciating pain in my knee, and then it would be in my ankle, and then it would be in my hips. And I'm like, every different day, it's like, what joint's going to be a problem when I get out of bed? I was bedridden from the vertigo.
And then you start to wake up with this pain. Like I woke up one time and I couldn't move my one leg, and you start to just be like, oh, that's okay. That'll be gone tomorrow. And it's gone tomorrow because it's somewhere else.
Yep, somewhere else. And
so
I'm
you
like,
stop being afraid of it because
crazy.
it's just like this thing that happens.
And it's very mentally taxing because I'm trying to figure it out. I have the science behind things, but I'm just like, gosh.
It's like whack-a-mole, and where is it going next?
Exactly. The fatigue was horrible, and the tremoring in my right hand, that was Parkinson's-like. And honestly, I'm so glad I videotaped that and took pictures of the cellulitis, the reaction I had, and some of these things. And I went to the doctor's office, and she was doing my readings, and she could see my charts, and she could see that my blood pressure was elevated, my heart rate was elevated. And
you were a patient of this doctor, so she knows this is not normal.
I was new to her because my doctor happened to retire during my diagnosis. So she took me on because he figured, well, you need a doctor, right? So the whole COVID thing, she had looked in my file and I'd come in for my checkups. Like I was not really sick. I had no issues. All my markers, my inflammatory markers, my sugars, cholesterol, everything perfect, always.
Is it a short video that I can put up on the podcast?
I could try to send it to you.
I'll help you figure out how to get it to me.
I just was going to say, in retrospect, here I was dealing with lateral pectoral nerves that had been cut. My pecs had been separated, pec major and pec minor, because they had prepped me for the wrong placement, but they did end up placing them on top of the pecs. I was dealing with nerve pain. I was dealing with metal toxicity, metal reactions. I was just a mess. I had no quality of life for those 3 months.
You said that you were referred to internal medicine 11 weeks post-surgery now, and you were presenting like MS Parkinson's, and then the explant was performed mid-November, and within 2 hours, your blood pressure is back to normal, your heart rate's back to normal. Did you experience a pretty immediate resolution of symptoms at the same time?
Yes, I was half out of it, of course, coming out of anesthetic, and I immediately look up at the machines there and I went, hey, look at that. And anybody that came in the room, I'm like, look at the change in my blood pressure, my heart rate. I had quite a bit of relief. The tremor was gone. The weakness in my left leg was gone. The migratory arthritis was gone. I had residual bouts of ataxia, so balance issues. I still had burning in my chest wall. But I would say I felt pretty good. You're detoxing. So I did a detox.
What did you do for detox? Because I get the question all the time, what is the safe detox to detox metals? Of course, it's different for people that have surgical hardware in the body because you don't want to do IV chelation because then that pulls from the surgical metals and can redeposit. What did you do?
This was before the deep dive I did into this gene defect and methylation and detoxification. I used Metagenics in my clinic. I ordered their Metagenics protocol. It allows you to detox through 2 pathways, the liver and the kidney. So I did that detox for 2 weeks. And then I took the supplement. It's a capsule. I can't remember exactly what it's called now off the top of my head, but I kept taking that afterwards. And I thought, oh, I'm done. I thought, well, I've done the detox. Apparently, you just have to kind of wait it out, maybe do another one. Some people say don't detox right away. The standard within breast implant illness is it takes 1 year for every year you had the implants, something like that. I'd get vertigo back for 6 weeks, and then it would just as mysteriously it would come back. There would be an onset. I'd wake up and it would be gone without doing Apley's maneuver or anything like that. And then the nausea would happen, and then I had a reaction to the sun I've never had before. So I took pictures of
I haven't never had a sun reaction too, but during the height of this, I went on a cruise in 2018. It all came to head for me between 2016 and really 2018, 19. But I went on a cruise in 2018. I was out in the sun and I was out for, I don't know, I was on a cruise ship, but I don't tan, I burn. So I'm careful anyway, but literally developed hives all over my body. I was allergic to the sun. I've never had that happen in my life.
Yes. I had what was called levita reticularis just on my legs. My hands went bright red. I have pictures of that. It's a lace-like pattern. And I'm sitting there just on my deck recuperating. This was 2021. I was like, holy cow, I look down and my legs feel like they're burning and I've got this reaction on my legs, but not everywhere. It was the weirdest thing. So anyway, my doctor said, oh, it's nothing. And then finally ended up back at the dermatologist and she goes, oh my goodness, that's that. And we usually see it with autoimmune issues. So I went, okay. I had it once later on in the summer. I didn't think too much of it, but it was right around the time when they took the implants out. I thought, okay, well, I'll start doing physio. I'll start recuperating. I got to get back to work. I wasn't getting any stronger. I looked at my chest and I went, I think my pecs have been cut. So then that started the whole talk about why are my pecs atrophying and why do I have bits and pieces that are not contracting and bits and pieces that are missing? And why do my pecs look like this? And why is my strength not coming back? And why can't I use this arm? I eventually talked to Dr. Khan, Khan in Novi, Michigan, and all he does is explants. He's a plastic surgeon. He will not put implants in because he's seen so much breast implant illness. So he's been a huge advocate for it. He called me on a Sunday night. I sent him my information. We chit-chatted. I said, I think I still have capsule materials. That scar tissue bag has to come out. Some plastic surgeons will tell you it dissolves on its own, which isn't true. Some women have very thick capsules that will calcify even. Some people have very thin ones, but it really should all come out. And there was a story about Angie Everhart, the model. And she had her implants removed and they left the capsules in and she wasn't quite well. And then they went back in and took the capsules out and she made a complete recovery. Okay. I still had these burning patches on my chest. So he said, send me your surgical report. First of all, my mastectomy with reconstruction was slated for 5.5 hours. I was in and out in 2 hours and 45 minutes. I guess I have small breast. Maybe it's faster. Okay. My explant was 90 minutes open to close. And I was supposed to get the implants out, but also take all the capsule out. So anyway, I was talking to him and he goes, well, an explant takes me 3 hours and it's done with microsurgery. He will guarantee that he picks it all out. So the capsule that's trapping the silicone and the metals, he will pick it all out. And he goes, Corrie, if it takes me 4 hours, I will pick it all out until it's all gone. And he looked at my surgical report.
Surgeon.
Oh, you need to interview him. He is a sweetheart. All of his patients love him. He said, looking at your surgical report, there's no way you could have had a total capsulectomy in 90 minutes. Usually the surgical report will say 80% of the capsules have been excised or whatever. There's no percentage given. Cautery was used. And he said, well, that's kind of gluing it into the tissue, burning it off. But I thought, I'm having these weird symptoms, so I must still have some left inside me, because when I had the implants, they were very round, defined areas of burning in my chest. It felt like I had boulders with sharp edges, but they were burning. And so I now had patches that I could literally, if I said to someone, give me a pen and I will draw them for you. I will show you where it's burning. I still think I've got some of the capsule left in. And again, still to this day, eye rolling. I went for a thermogram. This was in December of 2021 because I was still having issues. And she said, well, draw on the diagram where you feel the discomfort. So I drew a diagram of the chest and the ribs and everything and outlined where I felt it. We do the thermogram and I see the report a couple weeks later and it was identical. It shows where the heat and the inflammation still is.
To this day, do you still have the capsules then?
Yes, I do believe I do, yes.
Is your plan to go to this surgeon to get these removed? Will the same surgeon address that?
Yes, we've talked and he said, send me all of your metal allergy stuff. By then I had to wait to see the allergist, right? My plastic surgeon, she's booking the explant and she says to me, hey, I want to refer you to a dermatologist that does allergy testing for metals. I'm like, what? She goes, oh yeah, we got someone in the city here that will test for metal allergies for people who need knee replacements, hip replacements, need metal hardware, just to make sure that they can accept them and they don't react.
Bonus.
I'm like, I've been wanting this for 25 years or more. I'm like, I've been kept asking, where can I go? How do I figure this out?
So what kind of allergist and what kind of test?
Well, she did a patch test. So I was covered from neck to tailbone. They tested me for a whole bunch of things. And so they put the patches on and she had 2 residents with her at the time. And she walked in and she said, and this woman thinks she's allergic to surgical steel. And I said, well, yes, I do believe I am. So I explained my story. When I graduated from chiropractic college, I thought the prudent thing would be to get my boosters because I'd be in contact with a lot of different people. So I had a booster done on the left arm and one on the right arm. This is to digress a little bit, but my arms swelled up and I couldn't elevate my arms, and I'm an intern in clinic and I'm like, I got these red, painful, sore, itchy lumps on my arms. And I thought, okay, I'm weird. I react to things. So anyway, I was telling her about this. I was telling her about my dental amalgams, more eye rolling. The residents were kind of doing that like, okay, whatever, this lady's kind of weird. So I kept explaining my situation, showing her pictures of my blistering and everything. And so she tested me for thimerosal. I said, it's got to be a preservative in the vaccine. So they tested me for thimerosal. And of course, the primary component to be sensitive to is mercury. So I called it. She had given me the patch test and I was reacting. We were sitting there chatting and I could feel it on my back and not random locations. And I said, I think I'm starting to react. This was after 10 minutes. She goes, that's impossible. Nobody reacts that quickly. I'm like, okay. So I came back and she read the patches and she's like, holy smokes, are you ever sensitive? I had blistered and everything, right? So yes, I was allergic to thimerosal and mercury, but nobody ever talked about the stainless steel in the water jugs. Nobody ever talked about the metal pans. Nobody ever talked about the food sources.
That was the post that I went viral. It was the most bizarre thing. I just posted, your stainless steel water bottle could be making you sick. And that's the post that blew up the internet. Despite all the other really important stuff I've shared, that was the one.
Oh, that's cool. That's good. Yeah, because that would have caught people's eyes and went, what do you mean, right?
Right.
But everybody said, well, metal's everywhere. But I can't help it. I'm having these reactions. That's why I think that I still have some capsule materials on my chest because I'm still having some issues. And then I have some nerve entrapment and chronic pain issues. So they're doing hydrodissection where they're trying to free the nerve from the scar tissue adhesions because I had seromas developed and they were drained and lots of inflammations. I think there's some metal clips in there. So with his ultrasound, he uses ultrasound guided injections so that it's close to the lung and also it's safe. And he's been doing this for 20 years. He's amazing. I'm going to pursue that even more because I do believe that's one of my issues. And I still have some stuff trapped that I might be reacting to. I decided to pursue this instead of another invasive third surgery, just to see, because you're kind of in denial going, is this really happening to me? Yeah, I still have bouts of ataxia. Yes, I still have vertigo. Now, 3 weeks ago, I broke out in hives and blisters on my chest. I was sitting out in the sun before we got our snow. I hadn't eaten anything weird. All of a sudden, I felt like I was being pricked by a whole bunch of little pins, and then I turned red, and my husband said, what's going on? So I went into the bathroom, and I literally had hives all on my chest, and then they blistered, and then they were gone. I sat out in the sun the next day and nothing. And then I sat in the sun a couple days later and I got them again. And then this time, I was like, geez, I'm really hot. What could be burning me? I'm just wearing my cami and now I'm just out there in my tank top, my flatness. Right. And I go to the bathroom and holy cow, I have these red splotches on my chest that are fire engine red hot and they're burning. And now I have the rash and the blistering and the hives, like the itch and everything like that. So
what did your metal allergy test show you actually allergic to? What metals?
I would like to do the ELISA test. I'm allergic to tin, chromium, palladium, gold, mercury, and nickel. So I guess I can't go around stealing catalytic converters because they're made out of palladium. And everybody says you'll be fine with titanium if you need something in the future. But that's not true either.
No.
And I'm like,
and let's explain to people who are just turning into, who haven't seen the other episodes. Titanium contains trace amounts of nickel many times. The FDA doesn't require trace elements to be listed. So your titanium is never pure commercial titanium. It doesn't exist.
Yeah, exactly. So I was leery about getting an implant done. I thought, oh my goodness, just getting that thing in there is going to cause me a problem. I'm allergic to or sensitive to all of those metals. My biggest concern is both my parents had coronary artery bypass grafts, had triple bypasses. Mind you, they didn't eat very well and they were smokers. So that explains a lot. But what if I need a stent in a coronary artery? I think there's mesh ones. I don't know what I'm in for.
We need a surgeon that doesn't gaslight metal allergy patients and specializes in cardiac to tell us what our options are here.
My biggest concern was, what if I need open heart surgery? Could you imagine the inflammation? That would be what kills me. Mm-hmm. It attracts the immune cells. You start looking into reactions and I'm thinking, do I have a histamine issue? Do I have a mast cell activation syndrome? What's really interesting is they did place me on Lextin, which is an antihistamine, which takes the edge off. Unfortunately, I can't take it with the injections because it counters what we're trying to do with the prolotherapy of my shoulder.
So you're still a work in process and you're still suffering, and we have not seen the end of this story to date.
Yeah. I'm a little leery because it's expensive to have the exploratory surgery done to remove all of the capsule. And what if I run into complications there and I swell up or something? You know what I mean? It's very expensive to be sick in the United States. So do we drive like mad across the Canadian border? At least we're 30 minutes to Windsor.
Do you have coverage with Canadian insurance in the U.S. or no?
No, it's out of pocket. Plus, you want to avoid any complications or infections that would keep you in the hospital for weeks, right? Days even.
Socialized medicine isn't always all it's cracked up to be, for sure.
Yeah, exactly. So what I've decided to do then is, other than being frustrated with my thyroid, and there again, I've had my thyroid stable for 20 years and all of a sudden now I have all these issues and it's all over the map. I think it's due to what's left inside.
Your thyroid hasn't been removed.
No, it's still there. But I think after all these years of thyroid supplementation, they tell me it's pretty much non-functional.
I've got some questions to ask you about your cancer journey. Before you had the mastectomy and you had your biopsies, did they place any biopsy markers in your breast? And did you have any issues with those? Or do you know?
No, there were no markers placed. No, it was just a needle aspiration.
Did you do any chemo or radiation?
I was lucky enough that it wasn't in the lymph nodes. It's interesting. The oncologist said your 10-year survival is 96%. If you do chemo and radiation, it'll give you higher numbers. Maybe it was 96% with chemo radiation. I can't recall anymore. But he said, geez, chemo wouldn't be a good idea for you if you have metal allergies.
That was my next question. So, what do you do? And I react to everything, but now we know why. That's like my fear. So my mom had breast cancer. My grandmother had breast cancer. My great-grandmother had breast cancer. Yet I go and they tell me I'm not at much risk, but that's always in the back of your mind. I haven't really gone into chemotherapy. I really want to have a pharmacist on to go over metals in prescriptions, and that's coming. I'm working on that right now to talk about pharmaceutical drugs with metal allergies and possibly with chemotherapy drugs. Because what does the severely metal sensitive or metal allergic patient, what options do we have for chemo or radiation if you even go that way? I'm not really wired that way. I'd probably go more holistic, but yeah, nobody wants to die.
Exactly. I don't know if they would manage you with prednisone. I am not sure how they would. That's their expertise.
Those were very easy questions then. You plan on getting an LTT blood test, either ELISA or orthopedic analysis. Is that on your radar?
Yeah, that's on my radar because I'm not so sure that the patch testing is accurate enough. I don't know if I have other metal allergies.
I just did 2 episodes on the ELISA test, and ELISA is fantastic because they test 2 ways. They look at the morphology under the microscope, and then they also look at the reactivity of the cells. So they have a 2-phase verification, and they also test for a much wider list of metals than orthopedic analysis. I'm a patient of both. I've had both tests. Orthopedic analysis does the metal ion test, so they can actually test for the metal ions circulating within the blood, and ELISA does not offer that. It's kind of which one do you choose in your situation where you have had some systemic exposure?
Yeah, exactly. And so I think maybe what I'll do is decide to do that after I try to sort out this thyroid issue I have going on.
Do you follow a low nickel diet, and do you moderate nickels in your environment? To what extent have you done that with your sensitivities?
I've always sort of thought, I'm very familiar with delayed hypersensitivity reactions because I was able to diagnose my daughter with non-celiac gluten sensitivity. You could see the delayed sensitivity reaction. What you eat on a Monday may not bother you till a Wednesday and a Thursday. Meanwhile, who knows what you've eaten between Monday and Thursday. Knowing that and going through the list, I'm kind of like, maybe I should try to avoid certain things, right? I can honestly say that I wouldn't be surprised if I have intolerances in the foods, sensitivity to nickel like that, but I don't have any overt symptoms. I don't have any intestinal pain.
I don't have the acute dermatitis or the delayed dermatitis. I don't have that. I don't have the stomach pain. But I had general malaise. And as soon as I got a water pitcher that filtered nickel, changed to ceramic sand-coated cookware instead of stainless steel, got rid of the stainless steel water bottles, it has really made a big difference. It took a few months to see it, but it has made a difference. So I would encourage you to do that if you haven't.
Well, and since your last guest, who was talking about foods and nickel content in foods, I've been a lot more vigilant and done, again, more research on, we have Winners up here and HomeSense. We always used to go in there, and we have a similar store here. And I was just perusing the cookware, and I'm like, it says nickel free. I'm like, oh, cool. Just in listening to your podcasts, I've learned quite a bit. I know that when I was working with my daughter and her food sensitivities, that it can be pretty complex, but it's well worth it.
One of the big things with me, and it may bleed over into you or other people, is I was gluten-free for 10 years because they say you want to lower your inflammation, go gluten-free and dairy-free. And I've never been able to do the dairy. Just full disclosure, I love cheese. If I was on a desert island, it would be cheese and chocolate that I would take. Trust me. But I switched back. I'm able to eat gluten. I just stopped for general inflammation purposes, but I got gluten back because gluten-free grains are very high in nickel.
I've read that. And so we limit that. It's not like I'm going to go grab keto bread or gluten-free bread or anything. We just eat whole foods.
Yeah. When I switched back from gluten-free grains to gluten, I'm like, yes, sourdough. Give me the pasta, give me the sourdough. Let me gain 30 pounds. But yeah, it's an interesting thing. I do want to ask you about the black box warning. Tell us about that.
It's been discovered that textured breast implants, so the ones that are a little rough, giving better adhesion, better cosmetic effect perhaps, they don't put those in anymore, is my understanding. The word's getting around that the textured implants can produce a type of lymphoma associated with them. There's been thousands of women approach the FDA in pleading their case, 400,000 women with breast implant illness. The FDA has now, as of September of 2022, has held the breast implant manufacturers to a black box warning outlining the risks of lymphoma, squamous cell carcinoma, and breast implant illness, to include brain fog, rashes, joint pain, things like that. that is now on the breast implants. And there should be a consent form that your plastic surgeon or general surgeon goes over with you, outlining the risks, and then you sign a consent form saying that you're aware of the risks when you go to decide to do the implants. But even the spacers, so let's say you have your double mastectomy, your single mastectomy, and you want to do reconstruction later on, they will often put a spacer in there, and then they gradually fill it with saline to stretch the skin so that it makes it easier for the implant to slide in later. Women are having reactions to these spacers. And it was funny because my plastic surgeon says, well, we don't want to put that in you because it does have metal on it. My line of thinking was she must not have really realized that there were metals involved in the manufacturing of the breast implants. The big question now is women need to know about this. And some women have had their implants recalled. So when you get implants, you get a little card with the serial number and the make and whatever on it. And you're supposed to keep that filed away in a good place, because if they're ever recalled, you can check to see if your lot has been recalled. And usually you should get them removed every 10 years. Well, there's women walking around with implants that are 35 years old, not knowing that they've been recalled. The beautiful thing of social media and Facebook and groups like that is women are slowly finding out that, holy cow, I need to get these done. And it wasn't about 10 years ago that the most requested surgery by graduates that graduated high school was, please, can I have a breast augmentation? And so now the most popular surgery is explantation. Thousands and thousands of women suffering.
And something, actually, I had a professional piercer contact me about wanting to appear on the podcast, and she is trans. And apparently there is a whole bunch of metal allergy and complications showing up in transgender reassignment surgeries. And people are suffering tremendously, like female to male surgeries when they're doing penile implants, and the patient cannot urinate anymore. And they're having just horrific issues with that. Yeah. So I'll probably do a podcast episode on transgender reassignment surgeries, because that's a community that's really suffering.
Right.
You know? Yeah.
Yeah.
What do you think the prevalence of metal allergies is within the breast implant community? Is that something that's discussed on the Facebook group? And is that on people's radars, or does it only come up every so often?
I haven't seen it. I know that it's a reaction to silicone. I'm not sure if women realize that there's metals in the silicone and then they start to question if they have metal allergy or not. There's debate as to why some women get breast implant illness and some women don't. And again, I think it speaks to our ability to detoxify. It's the prevalence of breast implant illness. It's downplayed. It's not really acknowledged, except for this wonderful research article done by this PhD in the Netherlands that published the gel bleed and the migration of silicone particles. But I think there'll be more to come. And it's not actually just even metals. Like, you see these implants come out of these women, and some of them are destroyed and they're liquefied and they've ruptured. And imagine getting that silicone goo out of the chest wall. And in some cases, they're full of black mold. And they send the capsules for pathology, so you get an idea if there's bacteria, fungus.
Go back for a minute and tell me how you discovered there was metal in the implant. Did you write to the manufacturer? Did you get a list of the metals that were in the implant?
Yes, I did. I just went on the internet.
Can you send that to me so we can put it up in the podcast?
Yeah, I actually printed it off here. It's a huge document, and I can send it to you. But it lists all the metals, parts per million, etc., and all of the complications and risk factors. And they do say that, I believe, any complication, they don't list what, but 58%, 60% of women have some kind of complication with implants. But that can run the gamut from infection to bruising to hematoma to whatever. But I figured it out when I weaned off the prednisone and something wasn't right. And then I started to get that rash. I thought, I'm going to take an antihistamine. I'll know. And then I thought, oh, well, I have prednisone kicking around. I'll take prednisone. And when I took the prednisone, poof, the burning and the horrible pain. I went, I'm onto something here, because I spent so many sleep.
The metal symptoms or the prednisone symptoms.
Yeah, of course. Insomnia, and you're up all night due to pain and prednisone. I don't think I slept in 3 months, but I kept researching, like, what's going on? I have to figure this out. I absolutely have to. I can't live this way. I have the option of getting them removed. Of course, it eventually came to that. But I just went, you know what? what are these things made out of? So one night I Googled, I went allergen implant manufacturer's details, or what is contained, or what are they made out of, or whatever I Googled, or however I inputted that. And there it was.
Wow.
I got a 28-page document.
For whatever it's worth, any photos or documents you want to send, I'll put it up in the podcast show notes. So anybody that wants to see what we're talking about as far as rashes, materials, will be able to do so.
Right. You were saying about the prevalence of how common it is to react to metals. And I'm thinking, when I went to see the one dermatologist who said, hey, here's a script for prednisone, I said, it's a good thing I didn't get a tattoo. What a mess. And he goes, well, it's not the needle. It's the blue and black ink that contains nickel. And I went, oh, wow. And then now they're finding that these inks are migrating to lymph nodes. You got to wonder about chronic illness in that group, perhaps, that doesn't realize they're sensitive to the inks. It's just, like I said, when I found your Instagram post or your reel on Facebook, I was like, somebody is out there talking about this. So even my eyeglasses being metal, I've artistically coated them with clear nail polish so I wouldn't react to them.
Do you have to do that every so often? Does the nail polish come off, or does it work?
Yeah, sometimes you'll see it when it comes off because it'll peel, but you can touch it up. And I used to do that with the buttons on my jeans. I'd get like blisters and a little rash around my belly button area there from my jean snap. You just find ways around it.
I think that covers everything. Thank you, Corrie, for coming on. I'll just ask you in closing, is there anything that you want to touch base on real quick? And do you want to tell anybody how to find you?
Thanks for having me on. And thanks for spreading the word on metal allergies. I think your work is monumental. This has to get out there. And I think it's really important that healthcare professionals, doctors, nurses, people putting in implants, people doing orthopedic surgery need to learn more about this. There needs to be huge awareness. In terms of finding me, just probably on Facebook, but I'm not in clinical practice at the moment. I'm semi-retired.
We'll look forward to you doing great things within the community, whatever that is. And I just, as always, am super grateful for those of you to come on to share your story. If you have a great story, please, you can reach out to me through heavilymetalled.com. If you don't know, every episode has show notes. And if you go on the website, you can access those show notes, and they contain helpful links to resources, things that we've talked about on the podcast. If there's pictures or papers, such as the chemical constitution in breast implants, we're going to post that up, and you can find all of that on heavilymetalled.com in the show notes. We are starting a new thing of accepting patient stories regarding your experience with metal allergies. If you want to be anonymous, I can post those anonymously on a patient page on the website. And those will be available for people to come and read their stories again, so we all don't feel so alone. If you have a unique, special story that you want to tell on the podcast and you're not afraid to show up in video, please reach out to me through the heavilymetalled.com website, and we can talk about having you as a guest on the podcast. But it takes a village to change the medical narrative on this. And I just want to thank you for being part of the movement to tell the medical industry that we aren't going to take this anymore.
My pleasure.
Thank you. Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware, and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetalled.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.